attitudes towards end-of-life care have changed significantly and dramatically, and it's really in response to the public's demand and need for end-of-life closer to home. People want to be at home as long as possible at the end of life and have quality and dignity in that process. And so we've really needed to innovate, partner differently with different partners to think about different ways of supporting our clients to stay at home as long as possible.
Toronto Central CCAC has been a long-time collaborator with us at the Tammy Latner Centre for Palliative Care. We're primarily a physician group, and we've worked with the CCAC for the care coordination, nursing, PSW, all the other in-home services that the CCAC provides.
A couple of years ago, we got together and realized that while we were working together, we were not one team. So we were duplicating efforts, we were causing confusion for our clients.
And we thought there was really an opportunity to step it up and integrate services more closely.
Through that process, we created the Toronto Central Integrated Palliative Care Program. This program provides a dedicated integrated palliative care team for each and every client and their family with end-of-life and palliative care support needs in the community.
I feel very lucky that there's a service like this, because the nurses are there, the PSW workers are there, the doctors are there.
A key part of the integrated palliative care team is the palliative care coordinator. They function as the quarterback of the team. They provide leadership in bringing the care team together. The team consists of a palliative care physician, a dedicated palliative care nurse, a personal support worker, and a hospice volunteer. So based on what we heard from patients and families was important to them, we built the care team around that.
Any new issues?
He's been having a little more shortness of breath.
With providers in the community, they're not all in one location. And so the ICCP huddle allows the team to come together every morning for 10 minutes to discuss the care plans for their patients.
Every day we get on a conference call, and that's the physician, the nurses, the PSW supervisor, the hospice coordinator, and myself.
And the purpose of the huddle was very much to triage, and we talked about the importance of that just-in-time care to really keep people at home.
They're such a wonderful team. I couldn't ask for more because they're all working together, so I know that I'm in good hands.
It has improved care planning significantly and thus the care to clients, but it also has created efficiencies for the team by reducing, on average, 6 to 7 phone calls per care team member in a day.
The PSW and let her know.
The other innovation was our EMS protocols, where we developed a information sheet for EMS. So when they're called in to see our patients, they know we're involved.
What we were trying to do is have EMS contact us in a situation where they felt it was possible to prevent a transfer to the emergency department.
This has prevented many patients from having to be taken to the emergency department.
Hi Marian, this is Ashwarya calling.
Along the same lines, another key element based on feedback from patients and their families was there's so many providers, we don't know who to call when. And we really wanted to try to streamline that process.
Now they have one phone number and they are able to access the right person on the care team.
I think we will need some more equipment in there, yeah.
These innovations we've tested are possible, they're scalable, they're simple, and they can be done across the province.
We've already seen reductions in emergency department utilization, people ending up in acute care.
I don't worry about, being at home and staying at home and not having to be at the palliative unit in the hospital.
When you ask people, they want to be at home and at home as long as possible. But it also helps the healthcare system. It's very costly to have people die in a hospital where a hospital bed and resources are quite expensive.
If we can keep people at home for longer, and certainly if that's their preference, great that we can respect their preferences and also provide some value to the system as a whole.
It allows us to react quickly as well to keep our clients out of the emerge, as well as keeping them at home as long as possible, and ultimately just providing increased quality of care.
And the environment is better at home, definitely being with my family and knowing that I have care right away. Yeah.